Instagram moment. We did upper and lower eyelid on a patient. Let's see, today is Monday, so she had it done Thursday, so Friday, Saturday, Sunday. So today is post that day number 4. She made a request of wanting this mole removed. Sometimes we do it together, but a lot of times we do it separately because we don't really know how making the incision to remove this will affect our eyelid fold incision. So creation of the eyelid fold is the primary goal in the periorbital area at this time, and we can always work on the mole at a later time. And sometimes if there's a lot of swelling, if there's a lot of bruising, if the fold kind of looks funky for a week or two, we don't really do it. But open your eyes, please. Open. Look up. Yeah, the fold looks really natural. Looks really good. So I feel comfortable at this point working on this. I know I'm not gonna connect it, and if anything, I think I can perhaps make the corner end go up a little bit more, which will even make the hooding even better. So I think it will be beneficial for her. So at this point, on the 4th day, on her follow-up for the eyelid, we're doing the removal of this mole. Okay, so she's been numbed up, and I've had previous Instagrams showing how we go about doing it. There's a mole, you can see the hair coming out. So usually in a mole, it's like an egg shape. Half the egg is above the surface, and another half of the egg is buried below the surface. And when we remove the whole thing, invariably there's going to be a defect in the soft tissue. And as soon as we take the mole out, this defect, I'd say this is about 7 to 8 millimeters, would be widened by at least another 50%. So it's going to look like there's a defect of maybe 1.5 centimeter defect. And sometimes when you're doing at the time you're doing the eyelid surgery, it looks like you're going to end up just connecting everything, and you really don't want to do that. You don't want to make the incision seem to come all the way out here. So purposely, we are doing this in a 2-stage manner. Okay, hold this. Okay, so you can see clearly that there's a component that's below the dermis. Okay, keep on. Can you keep on? Yeah. That we need to follow. Otherwise, we incur a chance it's going to recur. So good. Very good. Okay. So literally, I'm wearing a loop, optical loop, for optimal vision. And when you're taking out what needs to be removed, nothing more, nothing less. But patients always have this curiosity as to how do we go about managing, situations where we have a couple of different things going on. In a situation like this, the eyelid surgery is always the most important. And if we can try to accommodate the patient for all their other needs, we will, but not necessarily on the same day. Okay. So you can see that this goes down quite a bit. Good. All right. Good. All right. You doing okay?
Mm-hmm.
Okay. So how has your experience been so far? It's been okay?
Yes.
The last few days has been okay?
Yeah.
Not too much pain?
No.
Good. I don't think you got too much bruising. You got some swelling, but I think that should go away very quickly. The shape looks very natural. I think you're happy with the shape. So look at this. It's this upper part, the domal part, the dome part, was above, and okay, let's go ahead. And it goes down quite a bit. It goes down quite a distance. So, and like I said, okay, we're almost finished here. Okay, okay. Here we go. So, for those who always wonder, what the ramification of taking these moles out is, this is the mole. This is the outer surface of the mole. The inner surface goes down quite a bit. Okay, so I'm gonna actually bisect it in half right now, and I'll show how deep this thing goes. So this whole thing is the mole. The whole thing is the mole. Okay, so we always end up with the defect quite a bit more than the original size of the mole. In her case, she's old enough that the elasticity has decreased a bit. On a younger patient, the elasticity would really widen the defect a lot more. So the trick right now is, can I get a quarter reader? I need a quarter. The trick is now to close this without affecting my crease formation. I don't want the crease to be like pretty pulled up and be exaggerated, but I think a little bit of pulling actually will make it look even better. So I gotta figure out how I'm gonna do that. So there's always a, in the moment, creativity or engineering component to what we do. Every mole is different depending on the location, and right now I gotta tend to the fact that I just did surgery nearby, and so in everything that we do, there's a nuance of a novelty, nuance of, hey, it's slightly different, or you can call it variation of the same thing, but there's always a little bit of figure out what's needed at that moment. Every puzzle is a new puzzle that we do. That's why it makes, I think, our job, I like to think, more fun, but this is what we do. Okay, so let me see. I'm gonna try to figure out what's optimal, which is the optimal way to go. Okay, good. I think if I can give her a slightly better pull, that'll be even better. So, okay, we'll push that out of the way for the time being. Can I have a 6/0? Okay. So the wound needs to be coarctated. It needs to be definitely approximated better than where it is now. Otherwise, the outer sutures will just, as soon as it gets removed, will make the wound just drift apart. So we gotta use some inner sutures to keep everything coarctated. Good. Good. So we're filling the defect from bottom on up. Okay. You okay?
Yes.
Okay, good. How long have you had this?
So many years.
20 years? 30 years?
Yeah, maybe.
Maybe more, right?
Yeah.
So you've been wanting to get rid of this
Yeah,
for over
first,
30 years?
First, this is it's like a pimple,
Mm-hmm.
and then I keep it like that,
Mhm.
then it goes like that.
Really?
Yeah.
So this is like your dream come true to get rid of this. You're gonna love it. Okay. Open your eyes. Let's show the mirror. Let's show in the mirror. Okay. You see it?
Yeah.
It's gone.
Yeah.
Open your eyes. Yeah, and you still look good.
Good.
This is what it used to be.
Yeah.
Okay. You did great. All right. I think we should.